The African American men had higher rates of hyperglycemia, hypertension, and hypercholesterolemia going into the study. But interestingly, looking at the side effects, they had higher rates of hypertension and hypokalemia. That wasn't something that we predisposed to. They had twice the rates of hypokalemia. That's an on-target effect from abiraterone. Abiraterone causes that by lowering the adrenal gland function and the hormones within the adrenal gland. So we hypothesize that in African American men, their tissues are getting greater exposures of abiraterone than in Caucasian men, and that's why this drug may actually be working better in that population. Now, it wasn't across the board. One area that we didn't see a difference in was radiographic progression-free survival. For both groups, it was about 16 months. But this study wasn't powered to do a head-to-head comparison. And so it's possible that there's a difference there if we did a larger study. And so what these results tell us in the end is, one, it's feasible to do race-based studies. That these patients have thought to been, we can't accrue them to clinical trials. That's not true. We absolutely can. Number two, there are differences when you do race-based studies, both in terms of the clinical efficacy as well as the side effects, and we need to do these kinds of studies. And then the third thing is that we need to understand this beyond race. It's not skin color, it's the genes associated with skin color. We need to understand what those genetic factors are. We have blood samples on all these patients, so we can now begin to look at the genetic factors associated with androgen transport and abiraterone transport to see if our theory holds that African Americans are more likely to transport this drug into their tissues and into their tumors at higher concentrations. So I think those are the really important messages here, and I think in the future the FDA and other regulatory agencies are going to need to mandate post-approval that these patients are studied so we understand if there are genetic differences by race associated with treatments in prostate cancer.